For the past month, we have been trying to understand the numbers behind Simcoe County's HART Hub. We reached out to county officials last week and again this week, asking whether those numbers are still under embargo. We haven't heard back.
In stats that we would love to share with you in program outcomes, we are under an embargo with our funder, with the province of Ontario, to be able to share those program level statistics.
A month ago, County Council got its first full progress report. The HART Hub is a pilot program funded by the province, $16 million over 3 years. It connects homelessness, addiction, and mental health services so people don't have to navigate the system alone. Some things about the program are public. Its capacity is relatively small, roughly 12 withdrawal beds at a time, with treatment groups cycling through every 28 days.
I think this model is something so unique and truly transformative for people, because it isn't a hand-holding service, but it is a hand-connected service, which is, so as they're going through services, they're passed to the next service, so there's no gap.
We have connected with hundreds of people across the county and connecting them to whatever pathway meets their needs at this moment, and we're going to continue to do that.
Staff say the program has reached hundreds of people, and nearly all of it operates out of Barrie, something township councillors were not shy about raising.
It's all wonderful. It's in the urban areas. What about the rural areas? You've got Township of Tiny, you've got Tay, you've got Ramera, a bit of a rural Menotti even.
Staff say the plan is to expand, with Barrie as the hub and new services branching into other communities. But that only happens if the province pays for it, and the county is making its case by pointing at other HART hubs it says aren't spending the money they were given. County councillors who visited privately saw pretty significant numbers of success, but the public can't see them. From what we can find, they have not been made public.
There is some limitation on what we can share publicly, but
what I will share is we are very excited once we are able to attain that approval. We will absolutely share those statistics and program level outcomes and evaluation.
That matters because this is a demo project. The evaluation decides whether the program survives. What the county did share publicly was one story. Staff told council about a client they called Edward. He had been homeless after a family breakdown, in and out of jail, in and out of the emergency room. Edward finished the treatment program, found an apartment in just 2 days, and has since regained custody of one of his children.
Proud of everything that he's been able to do, the team being able to work with them.
It's a compelling success story, but it's just one story. The public hasn't seen the numbers, and the same afternoon, council was asked for more money, up to $100,000 for a temporary staff position. The general manager said they may only need half of the money, maybe none at all. Council approved the full amount with a report back later on what actually gets spent.
Did you mention that only $50,000 was needed at this point, that you had secured another separate $50,000? Should we alter that motion?
yeah, through you, Mayor Measures, I think it's up to 100,000. It is like a mitigation of 50,000. So just in case the province doesn't come through, I would probably prefer it to be up to 100,000, and then we'll come back with a report on how much we actually needed.
Thank you, Councillor Snell. Good catch and well done. I will call it again. Those in favor? And that carries. Thank you so much.
The case for growing this program rests on results councillors have seen and residents haven't. A program this promising deserves numbers the public can see. A month after the county promised to share them, and 2 unanswered requests later, our research has found no sign they have been made public. Here is that discussion from Simcoe County Council about the HART Hub.
Community support and well-being. GM Fayez Baguette has a presentation here. We'd like to pass the chair over, or pass the floor over to Mina, and he is going to introduce the presentation.
Great. Thank you, Chair Measures. So here presenting our HART Hub program and a little bit of update for Council. This is the first time we are updating Council on this, so I'm going to have introduce you to Director Amy Marshall, Director of Community Safety and Wellbeing, and Katie Drake, the Manager of Homelessness and Addiction Recovery Treatment Hub, to share with you the journey we've been on for the last year and how the HART Hub is doing and what are the next steps in the program. And we can discuss a little bit about the report thereafter.
Warden, Chair Measures, County Council, community members and colleagues, we are really excited to be here today to provide an update and truly thank you for your time to hear a little bit about the heart of Simcoe County and where we have been, where we're going, and how we hope to expand this program as we, move through this year. Essentially, what we'd like to really review with you today, my colleague Katie Drake, who is the county lead as the manager of the HART Hub initiative, we really want to share with you some of the great aspects of this program, how we're working with our key partners in the community, and what to expect as this year unfolds. So I want to bring you back to 2025, 18 months ago in January, when we had the exciting news that we were successful in the application for the HART Hub and to implement and build that here in Simcoe County. Now, fast forward about 6 months later in June 2025, and think back to about a year ago this week, many of you joined us in the atrium to launch the HART Hub. And it was an exciting opportunity to have our partners together and truly start to connect with folks in the community. Now, following that in July 2025, we had the opportunity to welcome our first cohort of individuals into our Live in Addiction treatment program. So that was an exceptional time period to really be able to connect with folks and connect them to the services that they need, when they need it, where they need that. Now, from that point in about July 2025 to present, we have fully implemented all of our services, from the navigation team to community-based services to primary care to access to Indigenous care pathways, but as well as accessing other community-based employment and social supports within our community. So it's been a really great opportunity to see this program come from a concept, a thought, a discussion in a boardroom to full implementation. Now, there's no better way to hear about this program than through the lens of frontline staff. We have an incredible team that we're working with key partners, and together with our partners at, or our colleagues, I should say, in Service Simcoe, we were able to develop a video that really truly highlights that and shares from that frontline perspective where we are and what that kind of looks like for services within our community. So I'm going to share that with you right now.
HART Hub Simcoe County, the Homelessness and Addiction Recovery Treatment Hub, brings people, services, and supports together to respond to homelessness, addiction, and mental health with compassion and coordination. By connecting individuals to housing, care, and recovery pathways, HART Hub Simcoe County helps people move forward and builds healthier communities for everyone.
We work with a diverse range of community agencies that all try to come together to close the gap that these clients face every day. We help them through system navigation, trying to access resources that they would typically have a hard time trying to find in their day-to-day lives with the agencies they're already accessing. We give the clients the autonomy to choose who they are, who they want to be, and how they're going to get there.
HART Hub Simcoe County has created the service referral pathways with the integration of both people with lived and living experience and our Indigenous partners to create an Indigenous care pathway.
Having an Indigenous care pathway is really important to bridge systemic gaps and really initiate cultural connection almost immediately. We want to make sure that we're providing cultural safe, trauma-informed care and giving an Indigenous perspective of healing. Us as Indigenous care providers, we want to ensure that our clients are getting holistic care right at the first point of contact. And with that provides an autonomy in their care, ensuring our community members' spirits really taken care of. And with that comes safety and belonging. Cultural safety is essential to connection to our community members, no matter where they are at.
Creating low-barrier, local access to treatment was a priority. RBH runs a live-in treatment facility, pre-treatment and withdrawal management to support individuals through their recovery journey.
I think a lot of times, this population, they are constantly on survival mode and they lose hope and they kind of feel like they're outcasts. And I think with that being said, when they come here, we want them to feel safe. We want them to find a voice, to speak up, and just really build a family and community again. When clients are done our program, they fill out a little leaf just to encourage the next group that's coming through. Something on their hard days that they can kind of look at and say, okay, I can get through this, you know? A kind word kind of soothes the soul, right? So.
A key strength of the HART Hub is that support begins before treatment ends, connecting individuals with Waypoint's relapse prevention services to ensure continued care through in-person and virtual supports.
In our relapse prevention, they're primarily for the clients that we serve. So we offer different therapy modalities like cognitive behavioral therapy, dialectical behavioral therapy, seeking safety, lots of information and skills-based to help with emotion regulation, urges for cravings, and just building up their self-confidence.
In our family support groups, we offer psychoeducation for family members, friends, peers, anybody who is living or knows somebody who is dealing with addictions and mental illness, so that people can get a better understanding of what is addiction so they can support their loved ones, as well as hopefully try and get rid of some of that stigma that individuals tend to experience with the lack of understanding of what addictions truly is. It's a chronic brain disease. So having that understanding and that support can go a long way for not only our clients, but also the people who love them and support them.
HART Hub Simcoe County supports recovery after treatment through temporary housing and partnerships with the Canadian Mental Health Association, helping individuals prepare for independent living.
I think supportive housing means so much more than just housing. It's wraparound care support. It's supporting clients with activities of daily living, budgeting, employment. It's also the team advocating with landlords to secure affordable housing. We all support with individual goal planning, clients' goals, connecting them to our healthcare navigator, our addiction therapists, primary doctors in the community, and helping them maintain their housing in the community.
At the HART Hub Simcoe County, support is built around the individual. From navigation through supportive housing, people work alongside staff to access services, strengthen connections, and stay supported, no matter which path their journey takes.
We've been able to branch out and demonstrate to our community and on an international platform how we are integrating mental health addiction services along with healthcare. We are going to OMSA, which is a conference for the municipalities, to be able to collaborate with another HART Hub to demonstrate to more municipalities of how our integration of services is supporting those with mental health addictions and chronic homelessness. The County of Simcoe is working collaboratively with Waypoint, RVH, CMHA Simcoe County Branch, Barrie Area Native Advisory Circle for Mumaway, the Barrie Native Friendship Centre, and the Barrie Area Ontario Health Team.
As you can see, the HART Hub is truly more than just a program or a hub. It's building integrated care pathways across the community, bringing those crucial services together to be able to best support folks when they need it and where they need it. So I'm going to pass it over to my colleague, Katie Drake, again, the manager of the HART Hub initiative here, to give you a little bit more detail and talk about where we're going from here.
Thank you so much. So as the video highlighted, all of our services that are fully operational, you heard from all the frontline staff members who are able to deliver those services through integrated service referral pathways. We don't have one fixed hub location, so we do operate out of many different locations, but an advantage to that is that we are able to meet people where they're at. So while some of our physical facilities are located in the city of Barrie, we do connect with individuals. Our navigation team does go out to other communities. We are in Midland, Aurelia. We will meet clients on an as-need basis in other areas. We're not just situated in the city of Barrie. So our navigation team does work off of our by names list. They are reaching out and connecting with individuals who are experiencing chronic homelessness, addictions, and mental health concerns, and then meeting them, deciding with them what that service looks like, what they need, and where we can connect them. So there's not one specific pathway that is for everyone. It could look very different for anyone who's accessing services. So the best way for us to highlight that is for you to hear from a client who's received services. So for the purpose of our presentation, we are going to call him Edward. So Edward came into service and met with our navigation team. He had experienced homelessness. He had been in and out of our justice system, so in and out of our jails, as well as accessed our emergency department multiple times in the last year. We were able to meet with him. He was very interested in our live-in treatment facility. What that looked like was going to withdrawal management through RVH, then our, at that time, 21-day, now 28-day treatment facility. He graduated from that successfully and then moved into our housing supports post-treatment. So we were able to support him with our supportive housing workers. It only took Edward 2 days to find an apartment to rent from. The landlords were very clear that the advocacy that he had from his supportive housing worker with the HART Hub helped them to feel confident to rent that apartment to him. He is now housed, has been working, is able to return to work, and has held down employment and has regained custody of one of his kids. So we're very kind of proud of everything that he's been able to do, the team being able to work with them. I just wanted to kind of highlight as well that his story is not unique to any of the participants, but it's also not really how he got into the
where he was is not really unique to anyone either. It was due to a family breakdown, and then through that snowballed some situations. So it really highlights, one, that it could happen to anybody, and two, it's very much the story of the individuals that we're supporting. And now for our exciting where we're going, we have been operational again for the past year. So we're very happy to see all of our services operational. That included our pre-treatment to bridge the gap between withdrawal management and our live-in treatment facility. That was our kind of last step. So we are now fully operational. Part of that comes with an official name change from the Heart of Simcoe County to HART Hub Simcoe County. That is to align with all the hubs across Ontario so that we have similar branding. We are very easy to identify as all of the hubs together. We are continuing to strengthen our connections, work with our shelter service providers. Our navigation team continues to integrate into shelters, the library, pharmacies, anywhere that clients might be, to be able to continue to meet clients where they're at. We have also been able to expand some services with primary care, being able to help clients get connected to primary care physicians and things like that. And then we are also able to expand our supportive housing piece. So I'm sure I don't need to share with anybody that housing and affordable housing is something that a lot of people are in need of. And we have been able to expand for the Heart of Simcoe County another 13-bed program to be able to continue to support individuals for a 3 to 6 month stay while they look for more permanent housing. So that comes from having been operational for a year and kind of recognizing a need for that, feedback from clients, and just being able to give someone the opportunity to continue to work with our supportive housing staff a little bit more, to be able to look to more permanent housing and what that would look like for themselves. So anyone who has graduated from that live-in treatment program has the opportunity to work with our supportive housing staff, and then we will have the opportunity to move 13 of them into a little bit of a longer term stay to be able to continue that work. Thank you so much.
Katie, Amy, excellent work. This is indeed a terrific program that we launched just a short time ago, and it has made a great impact across Simcoe County. And so I just want to thank you very much for all the work that you're doing and your team that brings forward this great service that we're doing here. So well done. Thank you very much. Mina, do you have anything further you want to add before we move on to questions? You're good? All right, let's go to some questions. I see some cards. I hope it's all accolades. I'll start with Paul Van Staveren, who did represent us at a recent HART Hub event. So thank you, Mr. Van Staveren.
Thank you, Your Worship. And I guess this is a comment up with an accolade. So Katie and Amy, I had the opportunity, of course, to be there on June 11th to represent the warden and the county at the, I won't call it the opening, but the review of the new facility. And I'll tell you, if you haven't seen it, and it is closed now because of our clients that are in there, it's a wonderful brand new facility that's been renovated. So it was really nice to see. I came back out of there saying, you know, I've talked about the integration of services, but I tell people it's not a babysitting service. This is a service. It's a supportive system. And as the ladies explained today, to understand it or see it in action, it's something amazing. And it's hopefully very much a success story. And when we hear them going to other communities to spread the word, we'll say it's nice to see that we can do that sort of thing. So thank you very much. It was a great experience to be there, and good luck with your future endeavors. Thank you.
Again, thank you very much. I do have some folks here in the room as well as online. I'll get to them by order. And I did see Councillor Snell first, then Mr. Bell, I believe, and then and then Prost, okay? And then we'll get to everybody else. Snell, please. Thank you, Councillor Snell.
Thank you, Chair, through you. This is such a complex problem, and for decades, municipalities, communities, cities have been trying to find the magic solution. And in a lot of ways, I think we created a system that was so dysfunctional that a person who actually wanted to try to get help would just pinball back and forth between the system. Everybody was there for the right reasons, but nothing was connected. And so I think this model is something so unique and truly transformative for people, because it isn't a hand-holding service, but it is a hand-connected service, which is, so as they're going through services, they're passed to the next service. So there's no gap in that individual having to find the wherewithal to navigate for themselves, stay consistent, be educated, be connected to resources like computers and whatnot for that. So, you know, clearly we're seeing some huge advancements. And I think where we're seeing those results is that oftentimes, you know, we've all probably been touched by addiction and mental health issues. And when a person is going through that experience, they burn through their family and friends. And so they don't have anybody to turn to help them to find these supportive services. So I'm sure your staff have truly become their family. And thank you for that compassion. Where are we at, just as a question, in terms of, I had the honor of going on behalf of the warden a couple months ago back when we were able to travel through the supportive stations to truly understand how the system worked. And at that point, you showed some pretty significant numbers of success. Where do you sit today for council's benefit, please?
Through you, Chair Measures, I'm going to ask Director Marshall to answer that. There is some limitation on what we can share publicly, but she can share some details.
Absolutely. Thank you so much through you, Chair Measures. Excellent question. And while we have great information and stats that we would love to share with you in program outcomes, we are under an embargo with our funder, with the province of Ontario, to be able to share those program level statistics at this point in time. What I will share with you is that we have connected with hundreds of people across the county and connecting them to whatever pathway meets their needs at this moment. And we're going to continue to do that. What I will share is we are very excited. Once we are able to attain that approval, we will absolutely share those statistics and program level outcomes and evaluation. That's a key focus for us because this is a demonstration project. So we need to be focusing on those numbers. We need to be focusing on the evaluation to ensure that this program remains in our community. So once it's available, again, we'll definitely share that out. Thank you.
Well done. Thank you, Director. Mr. Bell, then Prost, then Follis. Okay?
Yeah, thank you very much. Through the chair. I mean, this is a great thing, a great program that you've designed. When we were in school, I took this in school. I did spend 6 years in the industry. Continuum of care, that whole spectrum is an important piece. Curious where are the referrals coming from? This is easy for us to see because we can look it up on the internet. We can call, we can make appointments. Where are the referrals coming from? Are they coming from the detox? Because even detox now, you have to make an appointment to go there, which is a barrier in my mind for the people that used to use it, right? So tell me a little bit more about that.
Director, please.
Through you, Chair Measures, I'm actually going to pass this on to Katie, who's going to talk a little bit about the navigation team and the connection for services.
Through you, Chair Measures. Thank you so much for the question, Councillor. So we are not a referral in service, so to speak. If you had somebody who was with you and you wanted to connect them, like you said, you can look it up. There's email addresses, but the unique piece about our program is that navigation team, which consists of workers from CMHA, workers from the county, and workers from Mamawe, so our Indigenous partner, go out into the community and are connecting with individuals. They have drop-in times at a couple of our shelters, our libraries, our pharmacies, to be able to connect with individuals and say, this is what we do. This is the services that we have. Is that something that would interest you? So people don't even have to find us. We're going out into the community to be present, to be in kind of their space, to be able to say these are the services that we have, so that you don't have to do that navigating. You don't have to know that it exists. We're there to tell you that it exists. We do partner quite closely with withdrawal management as well. So that is Detox. They are able to speak to somebody if somebody calls on their own accord and says, I would like to come into withdrawal management. You are correct. They do have to have an appointment. But the workers there, so the nurse there is able to see the list of individuals who are eligible for our services and immediately accept them into our services as well. So we have space to be able to go into withdrawal management and meet with clients should someone come there first as a first point of contact. There's really no wrong door. So anywhere that they go, they can access services from us. The shelters are quite familiar with us at this point. As well. So if anybody is there presenting and says, you know, these are the things that I've been struggling with, this is something that I'm interested in, they know when we're going to be there next. They have a direct contact to all of our workers. Thank you.
Great answer. Thank you.
Absolutely great answer. And it demonstrates the flexibility that this team has. I appreciate that. Okay, Councillor Prost, then it'll be Follis and then McDonald. Thank you. Please go ahead.
Through the chair. Councillor Bell asked the same question, but I have been through your, what would be yours, but when we were in London, I went through the health hub or the HART Hub. It was amazing. It was amazing. And I'm guessing it's the same that you have in Barrie.
I can thank you through you, Chair Measures. Excellent question. The HART Hub initiative is actually really unique depending on the community, and that's one of the really interesting and beneficial pieces of the HART Hub initiative. So essentially, what's needed here in Simcoe County is very different than what's needed in Hamilton or parts of downtown Toronto or parts of London. So you might have accessed the HART Hub there and seen the services and what that integrative care looks like there. Here, it's going to be really different. We took an approach of not necessarily having a hub-like model, but really brought together those referral pathways and utilizing existing services and facilities that our partners already have, which really helped us to move things really fast and quickly through this process because we used established buildings, established programs, established connections. So that's where it's a little bit different. So the services that they offer there, the intent of them are going to be similar, but what it actually looks like will be locally tailored to the community.
Yes, GM also, please.
Yeah, and really quickly, when we were applying through you, Chair Measures, sorry, when we were applying for the application, we actually presented it as a hub and spoke model. So we had our first system, we wanted to stand up very quickly and be first to act so that we could have the majority of the 3 years demonstrating with strong data its success, and then go back to the province in our written application already, planting the seed for 2 other locations. So we didn't want to limit ourselves to one centralized approach, but actually a system of services across the county rather than just in 1 or 2 locations.
Thank you. Just a quick follow-up. I'm really glad you guys are in the community because I believe the step-by-step actually helps. And I am glad you're in Midland. Do you connect with the shelter in Midland? Is there reading material around for people?
Through you, Chair. Thank you so much for your question. Yes, so we have handouts that have information on them. Because we are connected with community support and wellbeing and the caseworkers that are attached to our Ontario Works program, they go into the shelter. They are fully informed on kind of our program and what that looks like. Should someone be interested, we then directly connect them with our navigation team.
Great. Thank you very much.
Excellent. Thank you very much. We're going to move to Councillor Follis, then McDonald, then Leduc. Councillor Follis, please.
Thanks very much. I just wanted to start by saying I really appreciated the report, a lot of detail. I know I've had conversations with several service providers in Aurelia that have made referrals to the HART Hub in Barrie, so it is certainly a welcome resource on the Aurelia side of things. The one question I guess I had, just to give staff maybe an opportunity to provide some detail, was around the request for $100,000. How will that be used? As I was reading it, it sounded as if the plan is maybe to offset that with provincial funding when it comes in, but just any further detail you could provide would be helpful. Thank you.
Thank you, Councillor Follis. GM Fayez-Baguette.
Through you, Chair Measures. So Councillor Pallas, actually, it's a good question. We designed the report to give us an opportunity to backstop what we believe to be an upcoming offset. We're just waiting on we've asked the province for some flexibility in reallocating our investment plan in a way that would address the position that we're asking for in the report. Since the writing of that report, we've already mitigated that number down to about 50,000. So, and that's before we've heard back from the province. So we anticipate that we may not need it, but given the timing of the pilot and going in our second year with our expansion strategy to double the capacity of the program, we're doing this based on just strategically leveraging our own investments, including some of the rent supplements and some other things you heard earlier in the other reports, and really driving it towards getting those participants housed. So yeah, we believe that we'll probably fully mitigate it in the next few months. We're just awaiting provincial response.
All right. Thank you, Councillor Follis. We're going to go to Councillor McDonald, Leduc, and then Cox.
Thank
Go
you,
ahead,
Chair
Penny.
Measures. A lot of my comments have already been shared. But I just want to say that where you were was great. This is even better for what I see you going forward. And I think that every one of us here, our communities are affected. And with the growing need, I can't thank you enough from all of us, from our communities, because this is something that we want to see more Edward stories, because I think there's lots of them out there, as you shared, but I think there's a lot more coming. So thank you very much for your team, for everyone that's involved, for all the work that you do for those in need. Thank you.
Well said. Thank you, Councillor. Councillor Leduc.
Yes, thank you. Through you, Chair. Great presentation, great program. I think the program is very similar to what we already have in Bradford. We have what we call WOW Living, and I think it's a full wraparound service. My question is, and I know Councillor Verkuyt can speak greater to this, but he's a board member there with WOW. But we started Community Hub way back. We started way back in 2015 when I got all the services together and said, we need to get together under one roof so we can provide that service, because the biggest issue is if you have somebody looking to get help, the hardest thing is to actually coordinate that. And I think Councillor Snell talked about it, where you're all over the place. If you can get them under one system, it's the best thing for them. My question is, how do we connect these services? We already have a community hub in Bradford. We've been funding that ourselves. Our community's been funding that. We need to see these resources. And the second question would be, do you mean that the acquisition of the property that you acquired in Bradford for another program, how can we use that to help support the whole hub system or the HART system? So how can we connect these together? So we're not duplicating services. We want to make sure that we're taking these dollars and making them work for everyone.
Thank you, Councillor. GM Fayez, Bigot.
Thank you, Chair Measures, through you. So Councillor Leduc, so just to clarify, the HART Hub does have unique services in terms of the clinical care and the detox and the withdrawal management and pre-treatment services and the post-treatment services after someone gets housed. It does have a housing component too. But we do rely on our community partners like WOW, like the WOW program in Bradford, as well as other programs that were mentioned, from other comments, the guest house and other shelter programs. Our vision was to create a hub and the centralized program with the healthcare and clinical care happening in one location, in one municipality, and then connect into the other programs and grow them into bedded programs. So really our goal is to find different spokes to this model and create bedded programs in different communities. So possibly after we're done our commitment with the federal government on the property in Loft or somewhere, anywhere in the county, when those properties become available, those spaces become available, we'd be certainly pitching to the province that could be a potential spoke and how we would run it. I do think that numbers matter. I think the success of this program is it's in increments of 12 people at a time. We're trying to expand that capacity, but we have to be careful because we want people to succeed and not to, revert back into the program. So I do think there's a vision for that. Definitely our applications spoke literally to this idea of connecting throughout the whole county. And the real driver of our application was this idea of connection. So I'm confident that once, we get into the pilot's third year, we'll be starting to really push our advocacy on the future of the program.
Yeah, just a quick follow-up. And that's what I was hoping to hear, because, you talked about a spoke system, and we've got the central hub in Barrie, and you've got a spoke out now in Orillia and a spoke out in Midland, hoping that we can get something down to the southern portion of the county, because we have the same issues going on with poverty and everything else there. Thanks.
Very good news. That's good. Thank you, Councillor Leduc. We're going to go to Councillor Cox, then Councillor Riepma, and I'd like to call. So go ahead, Judith.
Thank you. Through the chair. Wonderful program. I think it's very excellent, but I'm going to be the person who's going to ask a question. It's all wonderful. It's in the urban areas. What about the rural areas? You've got Township of Tiny, you've got Tay, you've got Ramera, a bit of Oral Madati even. How and where are these services going to be connected? I understand you're in a situation where you are, but we still have issues in our townships, and we don't have the social services in some cases that is very identifiable, like a shelter, like all those things. And I think that's very hard in communities like mine and other people who are here to try to help identify and find places to help the other people. Thank you.
Through you, Chair Measures.
Yes,
That's
please.
an excellent question. I'm going to allow Katie to talk a little bit about our navigation team in more of a rural setting, but I also want to highlight a little bit of our community support and well-being department on the other side as well that is coordinated and connected to the HART Hub services. So part of our vision with our community support and well-being caseworkers, so Ontario Works was our previous name, but really providing those social assistance, that's a connection to any service in the community as well as to the HART Hub. So part of our priorities is ensuring that our caseworkers, because again, we are out in over 40 different locations across across the county, I should say. And one of our priorities is really looking at rural environments over this next year. Where can we go? Where are we able to meet people? Our goal is to meet people where they're at, not having folks come to an office, breaking down those barriers to ensure that people get the services when they need it, where they need it. And that's a key priority for the entire department. So I'm going to let Katie talk a little bit about the navigation team and how that also kind of combines together.
So our navigation team is very similar in the sense that yes, it's easier for us to go to a shelter because we can have a specific day we drop in, but say someone contacted us from Tiny, they let us know that this is something that they're interested in. They could meet them at the Tim Hortons that's in Penetang. They could meet them wherever they needed to, and then be able to speak with them. It does involve relocation to Barrie for the withdrawal management, the treatment piece. But if once they graduate treatment, they say, this is where my community is, this is where I want to return, the housing team will work with them to find housing in their home community.
Thank you very much. And supplemental, there are libraries, unfortunately, or Madani doesn't, but in Ramera, I'm sorry, you utilize libraries, not your fault. Anyway, and there are libraries that I'm sure a lot of people go to, and I know in Severn, we have one in Coldwater, and a lot of people utilize that library, but that's good to know because even if that information was in the library, a family relative, a family or someone could see that and know where to go for help. Thank you.
Thank you.
All right, thank you very much. I'm going to ask for our Claire Rietman to finish this up here, please.
Okay, thank you, Chair Measures. And it's a great program, and thank you for all the work that you and your teams are doing. I have two questions. One of them is, are there any pinch points in the current system in terms of capacity? And the second one is, again, dealing with capacity, where do we see this going? I know it's a pilot at this point, but do we need to put anything in place now or soon in order to make this program go forward? And I know that we should really thank the province for kicking in $16 million over these years, but do we have to go back to the province for a few dollars here and there too?
I'm afraid you're right. GM, would you like to take a stab at that one? Thank you.
Through you, Chair Measures. For the first question, maybe I'll try to answer a bit of it. In terms of the operation of the program, it does operate at a capacity of the withdrawal management beds we have access to. But there's, I believe 18 withdrawal beds, but we access about 12 at a time. But what we have been working with RVH and by creating an access point, Katie had shared, we've trained the nurses there that they can refer the list that we work off of for those experiencing homelessness. And if they come across someone that happens to have walked in, then they get added into the bed. So there's a way to ensure that the maximization of those beds are constantly happening. The opening of pre-treatment, which happened a couple of weeks ago, is also a big step because as people go through withdrawal management, the variable there is it's not necessarily everyone's the same. Some might need a couple of days, some might need a couple of weeks. Those who finish early now have a place to stay while they await for treatment, the treatment cohort every 28 days to refresh with a new group. So we are limited to the capacity of the beds in each of those three steps, withdrawal management, pre-treatment, and in treatment. But then what we did is we back-ended and opened up, and that's what this report is about, the capacity on that interim housing stage where people are working on final housing outcomes. So we've doubled the capacity there. So as still people come out, there's a steady flow and still enough space that you don't get backed up and you're declining people at the withdrawal management state. In terms of the second question in funding, So if you've heard a little bit here, we've tried to strategically leverage our own already funded services. So our community support and well-being teams that support the Ontario Works program, who are often common clients on that by names list, we're supporting them anyway. So the idea is with or without the funding, we'd continue to try to support and refer them to the program. When we began the application process, we knew it was going to be tough to get this. So we had that whole group of all the partners commit to trying to continue even without funding. We were lucky to get funding, but I think that commitment is still there. We've invested in the capital, the state of repair, and the other strategic alignment we've done. We've invested our own rent supplements to the program. So we still can create affordability, and the affordability doesn't end with the program. So we are advocating for constantly for more funding from the province, including because we were first to open, first to serve, first to have people housed. We are pushing the province on those who are underutilizing their funds and presenting that hub and spoke model, saying we're ready to expand and we're already set up to do it. So that's been the strategy, and we'll hope to continue that advocacy and see where it takes us. Thanks.
Thank you very much, Jim. I'd like to just acknowledge and thank Amy and Katie for your presentation today. And again, as I said earlier, the great work that you and your team are doing. This has been a tremendous project, and we're very, very grateful for your professional input and making it obviously a success in our community. So well done. Keep up the great work. And I'm sure that His Worship and the CAO are quite pleased that, our community of Simcoe was able to launch this program and set such a good standard of how it's supposed to be done. So well done. Thank you. GM Fay. GM, is there anything else you'd like to add? Or okay, we're going to move on to the actual recommendation, which is pretty straightforward. Perhaps I'll ask Councillor Prost. Would you like to move that? Councillor Follis, would you like to second that? Thank you. That the item CCW 2026-174 dated June 23rd, 2026 regarding the Homelessness and Addictions Recovery Treatment Hub Demonstration Project update be received. And that the County Council approve the staff drawing $100,000 from the Social Services Reserve to fund a temporary full-time equivalent position for up to 12 months or until the funding request is approved by the province and or the federal government. Anything further? Thank you. All those in favor? Oh, I'm sorry. Was there a question before I call it? Yes, ma'am.
Sorry, Chair. Just for clarification through the GM, did you mention that only 50,000 was needed at this point, that you had secured another separate 50,000? Should we alter that motion?
GM?
Yeah, through you, Mayor Measures, I think it's up to 100,000. It is like a mitigation of 50,000. So just in case the province doesn't come through, I would probably prefer it to be up to 100,000, and then we'll come back with a report on how much we actually needed.
Thank you, Councillor Snell. Good catch and well done. I will call it again. Those in favor? And that carries. Thank you so much.
For Simcoe Community Media, I'm Deepak Bidwai. This story was supported by the Local Journalism Initiative.